Hello everyone. In this video, we're going to be looking at primary biliary cholangitis. So let's start. So what is the definition of this disease? So it is an autoimmune disease which is characterized by inflammatory destruction of the small and medium sized intrahepatic bile ducts. So every word here is very important to remember. First of all, it is autoimmune. Secondly, mainly small and medium sized ducts are affected, and thirdly, they are intrahepatic. This disease was previously known as primary biliary cirrhosis. Also, this disease is more common in females. It has a ratio of approximate 9:1. Now, what is the pathogenesis behind this disease? So, as we just saw, it is an autoimmune condition. Here, the T lymphocytes attack the small interlobular bile ducts. Also, very important to remember, we have here what are known as anti-mitochondrial antibodies. These antibodies go and attack cells known as cholangiocytes. Cholangiocytes are epithelial cells which line the bile ducts, and specifically they attack the E2 component of the pyruvate dehydrogenase complex. This can come as an MCQ, so it is very important to remember. Now, what are the findings that we're going to see? So on microscopy, we will see that there is granulomatous bile duct destruction. These lesions are called as florid duct lesions. So again, important key point. We will also see ductopenia, which means absence of an appropriately sized bile duct in the portal tract. Now there are 4 stages of this which you also have to remember. So stage 1 is also called the portal stage, where the inflammation is limited to the portal triad only. Stage 2 is the periportal stage, where the inflammation is around the portal triad. Stage 3 or septal stage is where bridging fibrosis is seen, which connects the portal tracts. And stage 4 is cirrhosis, where regenerative nodules surrounded by fibrosis is seen. Now, what are the clinical features? So there will be fatigue, which is the most common and earliest manifestation. Apart from this, the person will have pruritus, which is itching, jaundice, and also hepato and splenomegaly. Some patients can also have xanthoma or xanthelasma. These conditions are caused when there is a buildup of lipids under the skin. Furthermore, because there will be cholestasis, the fat soluble vitamins will not be absorbed, because as you must be knowing, bile is necessary for the absorption of these fat soluble vitamins. An early manifestation of this can be vitamin D deficiency, which can lead to osteomalacia or osteoporosis. The patient can also have steatorrhea, and also very important, this disease is associated with other autoimmune conditions like Sjogren's syndrome, thyroiditis, and celiac disease. Now, if the patient does not seek any treatment, the liver can end up in cirrhosis. And if this happens, all the manifestations of cirrhosis will be seen, like Palmer erythema, spider nevi, ascites, caput medusae, etc. How are we going to diagnose this condition? So we can do liver function tests which will show serum alkaline phosphatase to be increased a lot, up to 4 times. There will also be increase in gamma glutamyl transpeptidase, but SDOT and SGPT may be normal or slightly elevated. So these are important points which they will definitely give in the questions. On blood tests, we will see thrombocytopenia, leukopenia, and anemia. We also have to do ultrasonography to rule out other causes. But you should note that about 10% of the patients with PVC may be anti-mitochondrial antibody negative. In such cases, we will do liver biopsy. And this is in fact the investigation of choice. So important to remember. How are you going to treat this condition? So we can give ursodeoxycholic acid or UDCA, which will slow the rate of progression of the disease, but it will not cure the disease completely. If the person is unable to tolerate UDCA, we can give obeticholic acid. Now, pruritus, which is itching, can be treated with antihistamines, narcotic receptor antagonists like naltrexone, and cholestyramine, which is a bile salt sequestrating agent. Finally, we can do a liver transplantation, which is the treatment of choice if decompensation takes place. So investigation of choice is liver biopsy and treatment of choice is liver transplant. That's it for this video. If you have any doubts, so please leave them in the comments or you can message me on Instagram anytime. The link to my Instagram is in the description. Thank you.